Hello, my name is Ingrid Sandoval. I will be talking to you guys about the plan process improvement through information systems. The objective of the assignment is to analyze the information that a clinician needs to manage a depressed patient based on their genetic information. In order to fulfill this objective, I will identify needed components. Such components include information needed on first call to a clinic, first visit, subsequent follow-ups, medications prescribed, and referrals given. Completion of this assignment depended on several assumptions. The patient is seen by a primary care doctor. It will be assumed that he is a new patient visiting his primary care doctor for the first time. The primary care doctor's practice has a staff model HMO, meaning that avoiding unnecessary visits are important to the practice in order to improve the quality of care and succeed financially. The EHR at the practice is designed to reduce unnecessary visits while improving quality. The informed patient is willing to take care of his own health provided that his doctors are easily available to him and willing to work with him. And finally, the patient is not diagnosed with a specific form of depression. When the patient calls the practice to schedule an appointment with the primary care doctor, the following information is collected by the receptionist: the patient's name, his date of birth, his phone number, and the reason for his visit. Another important piece of information that the receptionist is responsible for gathering is his insurance information. This involves asking the patient if he is insured or not, collecting the insurance information such as the name of the insurance, phone number, the ID number, group number, copay, and any important phone numbers. Doing this allows the practice to call ahead of time and verify the patient's coverage level and work with the patient to educate him on his benefits. At this time, exchange of information between the patient and the primary care provider occurs. Upon arrival, the receptionist collects the patient's demographics, copy of the patient's photo ID and insurance card, HIPAA compliance patient consent form, and verification of the reason for the visit. At this point, exchange of information occurs here as well. In addition to the patient's demographics, the practice collects the patient's health history, his vitals and symptoms, list of medications, and notes pertaining to his depression. During the visit, the doctor diagnoses the patient with a form of depression and prescribes him an antidepressant. Furthermore, the doctor directs the patient to schedule a 1-week follow-up where it will be determined if his form of depression is treatable with the prescribed medication. Within a minute after the visit ends, the prescription is sent to the pharmacy, and within 2 hours the patient receives a call from his pharmacy notifying him that his prescription is ready for pickup. During this step, exchange of information via the EHR system occurs between the patient's primary care provider and the pharmacy. During the follow-up visit, the primary care provider determines that the prescribed medication has not improved the patient's symptoms, and therefore decides that the best course of action to take is to refer him to a mental health specialist. The practice locates a psychiatrist that works with his insurance and redirects him there. The patient receives the referral and makes an appointment to meet with the mental specialist the following week. During the first visit, the patient's demographics, reasons for the visit, referral, health history, symptoms, and vitals are collected. At this point, an exchange of information between the patient, his primary care provider, and the psychiatrist occurs. Since genes are a major risk factor for depression, the psychiatrist decides to treat his form of depression based on his genetic information. In order to accomplish this, the psychiatrist uses a DNA kit and collects the patient's DNA sample, in this case, his saliva. The kit is then sent to the laboratory. In the meantime, the patient is prescribed a new antidepressant and is given an appointment for a following day for a therapy session. At this point, exchange of information between the psychiatrist and the pharmacy and the psychiatrist and the laboratory occurs. During the second visit, the therapy session is conducted. The patient is also given a plan of action to take in order to make lifestyle changes, such as improving his nutrition, exercising, building social support by volunteering, etc. At the conclusion of the second visit, the patient is told to continue taking the prescribed medication, and the patient is given 2-week follow-up, allowing the psychiatrist enough time to receive the DNA results and plan an appropriate course of treatment. During the 2-week follow-up, the psychiatrist receives the results from the laboratory and explains the genetic results to the patient, diagnoses him with a specific form of depression, gives him a new treatment plan, which involves taking a new antidepressant, and advises the patient to continue making positive lifestyle changes in order to maximize the results. In addition, his genetic information is updated and uploaded to the psychiatrist's EHR system, where it is then posted on the patient's online portal and communicated to his primary care physician. The prescription for the new antidepressant is sent to the pharmacy, and within the hour the pharmacy calls the patient, letting him know that the prescription is ready for pickup. The psychiatrist then advises the patient to make a 4-week follow-up appointment. During this exchange of information between the psychiatrist, the patient's primary care provider, and the pharmacy occurs. After 4 weeks of following the treatment based on his genetic results, the patient's condition improves. It appears that the lifestyle changes, new antidepressants, and therapy sessions contributed to the results. The psychiatrist advises him to continue his treatment regimen and advises him to make an appointment with his primary care provider as needed. For example, in case his symptoms return, or to update the doctor on any concerns he may have. The following form shows a use case document, which serves as a way to demonstrate the actions and events taken to define the interaction between each actor and system in order to achieve the goal of coming up with a treatment based on the patient's genetic information that generates positive results. The following chart depicts the exchange of information between healthcare facilities. As you can see, only certain type of information is shared with all healthcare entities. When it comes to the genetic results, initially only the psychiatrist who ordered the genetic tests and the laboratory exchanged the patient's genetic information. However, once results are back, the genetic information is shared with the primary care physician in order to update the patient's information on their system as well. The following flowchart depicts the flow of information between health entities. In this case, the flow of information ends when a treatment based on the patient's genetic information is created. The purpose of this assignment was to gather and analyze data needed by clinicians in order to create a treatment based on the patient's genetic information. The process covered the following topics: exchange of medical information among healthcare facilities, updating a patient's medical history on EHR systems, creation of medical treatments based on the patient's genetic information, process improvement with the use of electronic health records. Ultimately, the patient ended up visiting his healthcare provider 6 times in a span of 8 weeks. Though this may seem like a lot of visits, in my opinion, the process implemented reduced the patient's visits because it allowed the providers to develop an effective treatment plan based on his genetic information that ultimately served to help address his symptoms. Depression is a very difficult ailment to manage. Therefore, finding a solution in the span of only 6 visits is exceptional. In my opinion, this assignment helped me better understand how patients' experience can be improved through the use of EHR systems. In particular, this assignment covered 5 ways in which EHR systems improve the process of care, and they included enhancing communication among healthcare facilities, thereby improving their coordination, reducing potential errors, minimizing the amount of visits, reducing a patient's wait time, educating the patient on both his insurance and treatment plans. In my opinion, the only limitations that this assignment had was the fact that the assignment was based on theoretical patients receiving theoretical results and treatments. The process was also hindered by the fact that I lack clinical and managerial experience. Nonetheless, there is no doubt that this assignment served as a great practice for similar situations in which I might deal with in the future. Thank you, and these are my references.